COVID-19 case counts seem to drop here in the islands, but Hawaii's hospitals continue to feel the strain.
Joining us now live is Greg Christian, Hawaii Market President of Kaiser Foundation Health Plan and Hospitals. And thank you so much, Greg, for being with us here tonight.
My pleasure.
Thank you. And so, we had about 1,900 new cases reported today in Hawaii, which thankfully is less than we've seen in recent weeks. And we continue to see the case counts dropping. What are you hearing as far as whether the worst of the Omicron variant is behind us?
Right. Well, one of the things that I think this community has done really well is really come together as a healthcare community with our government leaders as we work together to really fight this battle. And I believe this week we started moving from sort of a real 2 or 3 week period of just flattening to actually beginning to see some reductions. Now, for us in Kaiser Permanente, we have a full membership model, so we do all of our own testing. So we're able to know the numerators of tests, and we can, since 2 or 3 weeks ago, we've dropped about 70% from a height of 2,800 tests a day to today, we hit about 800, and that's across all neighbor islands as well. So that's usually data a couple, 2, 3 weeks ahead of what we're seeing in our hospitals, but we are starting to see some small drops in our census across the state today. If you take a look at all inpatients in all health inpatient settings across all hospitals, all neighbor islands, et cetera, it's dropped a little bit, not a lot. In our medical center, we've dropped from a peak of 52, and today we had 24 patients. And the key thing that you'll hear us all talk about is the importance of being fully boosted, because all but 3 patients were not fully boosted with the vaccine. So Omicron, I think the false narrative out there about Omicron is that it's safer. No, it's not. It's very dangerous. And what you'll hear from our infectious disease leaders is that if you are fully boosted, you stand a much better chance. The risks do go down substantially, and we do have a better fight than what we had against the Delta variant. So it's still something to reckon with.
It's great to hear that the numbers are dropping. Of course, you spoke about staffing shortages at Kaiser's hospitals in a press conference last week. So what is the situation now? Have those numbers dropping helped at all with that?
Yeah, well, they are starting to drop a little bit, but let me give you a little bit of a full picture. Very interesting. I was spending time today with a couple of our members, and our employee health were sharing that in the month of January for us, we've had far more infections of Omicron of our staff than we've had since the pandemic started through the end of this past December 2021. So what that tells us is that Omicron spreads super fast. Most of what we're seeing in our hospitals is coming from the family gatherings of Thanksgiving, Christmas, and that kind of thing. But like I was saying last week to several folks, it is on our porches and on our front doors knocking, wanting to get in. So we all need to know what we must do to lower risk, and the booster is the best weapon out there.
You had spoken about some doctors and nurses pulling double shifts and really pitching in to help. What are you folks doing to help prevent burnout?
Yeah. Well, first of all, I can't answer that question without an amazing shout out to our physicians, our staff, our nurses. And I know my colleagues have expressed the same thing. They truly are heroic. I mentioned in that press conference, in my 40 years, I've never seen staff take on so many extra shifts and work so hard. And I also said that if many people could walk through the wards of an ICU unit or a hospital, I think it would change minds about this real pandemic that we're in. And it may not change all, but I think it would make a serious impact. So yes, the interesting thing about this surge is that so much exposure has created a great deal of testing and has kept a lot of our workforce out of the hospitals. Now, we're on the downtrend of that. For us in Kaiser Permanente at our hospital at Mauna Loa, we at one time hit close to 140 staff just through exposures that couldn't come to work. But with the help of our hospital association, we have been able to get some FEMA relief for the entire state. All of our hospitals have received some FEMA relief, which is, we welcomed them with balloons and cookies last week, and we're getting a few more next week to help in our clinics. In Kaiser Permanente, we're a health plan and a clinic system along with a hospital. And so we even need them in our clinics. And that's really where we want to take on this fight. When patients get to the hospital, that's much later than where we need to be. So.
And, is there anything that's going on behind the scenes? You mentioned if people could just walk in the ICU or walk in the hospitals, it might change their minds. Anything else that, staff or even the patients are dealing with that we might not know about on the outside?
One of the things that's interesting about this too, I was sharing that about half of the patients that are coming in, it's dipped as low as 30%, but has half of the patients that are coming into our hospitals are not coming in because of COVID. You might have a mom delivering, you might have an appendicitis, you might have a number of different diagnoses for why the patient has come in, but we're finding because of our testing, they too are infected. So really the narrative out there that we want to get out there is take your booster. Here's an interesting stat. If you took your booster 4 months ago, you have an 8 times better chance of not being infected than if you just took the 2-shot vaccine. So really think about that. It is the best weapon. The thing that I try to explain, because we all have friends that are either for or against the vaccine. The important thing to remember is in this battle, it's all about reducing risk. What is the best weapon you want to use to reduce risk? Your healthcare leaders are going to say, without question, the data and the science says booster. But if you choose not to use the booster, what are you doing to still be responsible to help in this fight? That's for masking, social distancing, washing your hands. There's still things that can be done, but your healthcare leaders and the scientists will tell you, please get that booster.
We're all in this together. Yeah. Well, Greg
Absolutely.
Christian, we want to thank you so much for your time tonight. We appreciate you stopping by. Hawaii Market President of Kaiser Foundation Health Plan and Hospitals. Thank you again.
Thank you.
My pleasure. Mahalo.